We are here today in this hearing to discuss the Department of Veterans Affairs' use of telehealth as a modality to deliver care to veterans, especially those in parts of America that are rural, highly rural, or tribal lands. For my entire time that I've been a member of Congress, I've been a proponent of telehealth as a way to deliver care to veterans and, in fact, to all patients, particularly those in Kansas, and especially those who live in rural areas. It has great potential. Currently, we see these capabilities being utilized for an even greater share of veterans due to the pandemic of COVID-19. COVID-19 has unexpectedly accelerated the process of expanding the VA's use of telehealth. In recent years, the VA has advanced its capabilities, but in the spring of this year, as the country and the VA prepared for the anticipated spread of the novel coronavirus, telehealth was often the only safe option to provide care. The consolidation of resources at VA medical centers, postponing non-urgent in-person care, and restrictions placed on referrals to community care fueled a more widespread use of telemedicine. As we continue to move toward a new normal, it is essential that the VA optimize the use of telehealth delivery where it works best, build on the lessons learned where it can be enhanced, and recognize the limits of its utilization. Telehealth has great promise, and the unexpected expansion of telehealth has yielded great knowledge in the last few months. There are many times where it's practical for a veteran to see their provider through VA Video Connect or even through just a conversation by phone. While this flexible and time-saving modality can be great in many ways, we know telehealth cannot entirely replace the need for face-to-face medical appointments. This is true as it relates to access to care in the community, and the VA must ensure that full implementation of the Mission Act to increase access to community care is pursued. The limitations of telehealth are also amplified for those living in rural America or Indian country. VA Video Connect only works when you have a broadband connection at a certain speed. In many parts of our country, that reliable broadband service simply is not an option. I'm disappointed that the VA chose not to participate in a recent listening session led by this committee with key stakeholders from across the medical community, telecommunications industry, VSOs, and other federal agencies. As of 2019, rural veterans make up approximately 1/3 of VHA enrollees and are, on the average, older than their urban veteran peers, tend to experience higher degrees of financial instability, and often live with a greater number of complex medical health needs and comorbidities. Many veterans in rural America and Indian country live prohibitively far from VA facilities, which underscores both the need for innovative solutions on how to reach them and the importance of access to community care. For rural and tribal veterans, the geographic barriers to VA care often go hand in hand with poor or non-existent connectivity to the broadband necessary for high-quality care via telehealth. I applaud the VA's outside-the-box thinking with regard to creative partnerships with the private sector and VSO community and the distribution of wireless devices to isolated veterans. Additionally, I'm interested in learning from our witnesses today the progress the department has made on forming agreements with telecommunication companies to provide subsidized short-term internet access to rural veterans. This is a provision I was proud to champion in the CARES Act in an effort to better serve the mental health care needs of rural veterans, especially during a time of social isolation during COVID-19, and look forward to hearing the progress the VA has made on this front. It's also important to note, in addition to skyrocketing numbers of telehealth appointments, the VA has also been called on to fulfill its fourth mission across 46 states, including my home state of Kansas, as well as the District of Columbia, Puerto Rico, and the Navajo Nation. As we look forward to both the near-term needs and the long-term goals, the VA should make certain that the innovation of telehealth is utilized in the most efficient and appropriate way. I look forward to hearing from all of our witnesses today on these challenges and opportunities and how we can work together to best leverage this modality to address long-standing access to care issues. I understand that it has not been easy to adjust how the VA delivers care, especially at the rapid pace that COVID-19 pandemic has required. I thank the VA for its work, and I thank them for being here today, and I want to yield now to my colleague, Senator Tester, who may be in the Indian Affairs Committee, where I'm also supposed to be. Senator Tester?